Momentum 3 is a trial designed for a very specific population of patients with what we call advanced heart failure. Advanced heart failure is the culmination of years and years of suffering in patients who have been tried and tested with guideline mandated medical therapy who are now becoming refractory to it. Often they have problems with end organ function. They cannot do their activities of daily living. They cannot even go to the mailbox to pick up their mail. So they're very, very limited in their quality of life. In such patients, typically the only two things that we can do to improve their quality of life in the long term include heart transplantation or the placement of artificial heart pumps called left ventricular assist devices. Heart transplantation, as you might imagine, is quite limited by its donor resource. We can only do about 4,000 heart transplants a year in the world, whereas the need in this space extends to 50,000 or even greater worldwide. The technology used in Momentum 3 is part of a group of devices that we call left ventricular assist systems. These are surgically implanted devices that remove blood from the left ventricle. Using a motor, that blood is then pumped into an ascending aortic outflow graft. These devices are implanted either in the chest or in many cases they're implanted in the abdomen. These devices have really followed the time course very similar to what we have observed with car technology, for instance. So for 50 years these devices have been in development, and just like the Model T Ford, which has now transitioned to the smart cars that we see today and the luxury vehicles that we see today, we have seen this disruption in the space of ventricular assist systems as well. The device we used in Momentum 3, the novel device, is called the HeartMate 3 device, and this is a unique device in that it's a fully implantable pump in the thorax. It sits practically on the palm of your hand, and this device has a unique motor that is fully magnetically levitated. What that means essentially is that it's a frictionless motor. It has no bearings, they're not subject to wear and tear, and that allows durability for this device. We also engineered this device in a way as to create more wider blood flow paths so that when blood is entering and exiting this particular device, it is not subject to shear stress where we destroy the red blood cells. The idea being that we do not want to risk clotting within the device, which has been the bane of our existence with these devices, where 10 to 15% of patients require to go back in for a surgical operation and have a second device put in because the first device just clots off. The HeartMate 3 is uniquely designed to avoid pump thrombosis. So Momentum 3 is the largest left ventricular assist system study ever conducted. This is a randomized controlled trial that randomizes patients to a one-to-one format to either a control device, which is an older form of a currently available pump called the HeartMate 2 device, a current generation device that essentially is an axial flow pump with a mechanical bearing in it. This is a device that has been shown to have a high risk of pump thrombosis and other complications. The HeartMate 3 was randomized to this device, and we followed patients up to about 2 years to see how they performed. The primary endpoint of the trial was survival free of a disabling stroke or a surgical reoperation to remove or replace a malfunctioning device. So very hard endpoints in the primary endpoint. But we looked at other adverse effects as well, and one of the adverse effects of great concern to us in the field has been stroke rates. And so we particularly focused on strokes as well. We were extremely gratified with the results of Momentum 3. At the 2-year mark, we saw a marked improvement in overall survival. So in all of left ventricular assist system studies, we have now observed the longest 2-year survival and the highest 2-year survival noted at 83% in this very, very sick group of patients. The second important thing that we observed in this trial was that the primary endpoint was met with a very high fidelity in this particular trial. The control device reached the primary endpoint about 56% of the time, whereas the HeartMate 3 reached that at 2 years almost 80% of the time. And with a highly significant difference, and met its superiority endpoint, indicating a halving of the hazard ratio of this trial population. The second important area that we focused on was to see what the effect of this device was on neurologic complications. And we were extremely gratified to show for the first time in the left ventricular assist system world that neurologic complications were halved with the use of this device, with only about a 10% rate of stroke at 2 years, as opposed to a usual rate of stroke that we always quote to our patients of about 10% per year with left ventricular assist systems. So we are certainly seeing evidence that the HeartMate 3 is what it was engineered to do, and is in fact a much more hemocompatible device that improves survival and improves the outcome of these patients while lowering some of the adverse events such as stroke rates. This game-changing result that we've observed in Momentum 3 will likely open up the field to a much more wider group of patients who would previously not have been considered for such device therapy. And this is a group of patients called destination therapy patients. These are patients who may not have the hope for transplantation for one reason or another. Maybe they're too old, maybe they have too many comorbidities. Now if you have an off-the-shelf device that shows not only durability at 2 years, but also a marked reduction in complications like stroke, we actually feel that this device will open the gate for more patients being helped with this entire technology. So that's our hope in the immediate future. We still don't have the perfect device. And one of the challenges with left ventricular assist systems even today is how they're powered. So even today, the HeartMate 3 is powered with a driveline that exits the abdomen and then connects to an external battery pack that is worn by the patient on their shoulders, or during periods of rest hooked up to a wall plug. That's the biggest challenge. That is, that while we are seeing a much more forgiving device in terms of hemocompatibility, we have not yet seen the most forgettable device. And the future research is going to focus on devices like ventricular assist systems becoming forgettable to the patient, where we have internally powered drive lines with power sources that fully internalize the system. That's the next step.